Okay, today's morning medicine is, we're starting, Carboneum sulphuratum. So this is I'm still in the carbon section. Yesterday's was two medicines, carbonium oxygen and carbonium hydrogen. So they're mixing hydrogen with carbon, hydrogen with oxygen, and this one is uh, sulfur with carbon. And this one is used to make, I think, rubbers and things like that. What the heck's going on? Huh, interesting. Different look on my computer. It's working though, it seems. So anyways, uh, they're mixing these different, now carbonium was just carbon, it was from lamp stuff. And we had carbon tetrachloride. The main ones were carbo-veg, that's a big one, and carbo-animalis. Those two carbons were the really big carbons that I did. And that was the beginning of all this. And then it went to from carbo-veg to carbolic acid to carbo-veg. Oh, that was in between. Carbon tetrachloride. What was the other one there? Carbo-veg. Oh, carbolic acid. That was a decent one. Carbon tetrachloride. Carbonium. And then carbonium hydrogen, carbonium oxygen, and today is carbonium sulphuratum. And each of them have the carbon elements. The carbon element has certain symptomology with it, symptoms with it, and each one of them have their own different symptoms. Now, carbo-veg is just, which is one of the major remedies, and that's all you need to learn is these major polycrest remedies like carbo-veg, carbo-animalis, even carbolic acid is a decent one, but basically the carbo-veg and carbo-veg is the biggest in these carbons. Carbo-animalis is another fairly big one. So they have a little bit of distinctions. One's animal carbon. They burnt the hide of an ox. I think it was ox hide. And then vegetable carbo-veg was burning of vegetables and then make a medicine out of it. So that's what's giving them the carbon. And then like carbonium is you have an oil lamp and that carbon that forms on the glass, they took that and made a medicine. I know this all sounds like witchcraft or something, or eyes of newt and all this stuff, but when you experience it and you see it work, you're just totally amazed. I was just on a call yesterday, and the one homeopathic lady is over in San Francisco, and she's got a thriving practice, and yeah, it's very interesting to see how when someone does usually the homeopath gets someone that runs out of, choices. The doctor says, that's it. We can't help you anymore. That's a shame. But, if we were to get them earlier, and then some people who have this problem and it's not a deadly problem or a problem that they can't fix, but they just keep taking the same drugs and the same medicine and nothing's getting better, and actually their health is getting worse from all the drugs. Then I'm going to go to alternative medicines. They try herbals, they try this, and then once they try homeopathy, they're like, "Whoa, that stuff really worked." And I don't understand people. That one lady, I told her to get gelsemium. Child has COVID. All I got was she's just laying there. She's not moving. Go get gelsemium. Gelsemium's one, that's the key. You learn the keynotes of some of these. Oh, she has burning, with this COVID. If that would have been the case, go try arsenicum or causticum. Her body just totally aches, Bellus perennis, arnica, these kind of medicines. So you learn some keynotes of some medicines, and 9 times out of 10, it works, you know. And then when it doesn't work, you're thinking, what the heck's going on? So I'm giving carbo-veg or something, carbonium to people for something that sounds like carbonium. And then, but they have some sulfur symptoms. So I give them sulfur. I try that. It's not working. Now you give the combination of carbonium sulphuratum, and that can clear it up. So that's usually it's the major remedies like carbo-veg, sulfur, um, thuja, a bunch of different medicines that are there's a a little over a handful of them. There's a basic amount, 20 some remedies that if you get to know them, arnica, arsenicum, aconite, nux vomica, these different medicines, you get to know them and you see that and you give it to them, and there's some things that you try medicines and they're not working. And that's the hard part with homeopathy. And that's why you give a medicine that doesn't work and people are like, this is crap, you know. Or like guy at work, I told him bryonia, take bryonia. He's taking a bottle of water, bryonia, he's taking it. All of a sudden he comes back, he's jumping up and down. My knee's better. It's totally better. And it was, I don't know how long I was aching him for. But anyways, he's jumping up and down. He says, I'm going to buy a kit. Well, the problem is you won't know what to do with that kit. So, invite him, come in and hang out in my community. Just come in and check it out once a day. Get to know a medicine, get to know this and that. Bring a case. I'd love to sit down with people and talk to them and teach them how to look at one of their relatives, their case, their wife's case. Right now I'm dealing with my mom's getting a slight dementia, Alzheimer's. I don't know what's going on there, but yeah, she's got the memory loss, some memory loss. And then when she can't understand something, she screams and yells and, like it's gonna, cause everybody to back off and not question why she's not understanding. So I'm trying a few medicines and I can't give her a medicine because she doesn't, oh yeah, right, you're a doctor. No, I'm not a doctor. I'm just trying to teach people how well homeopathic medicine can take care of things. So I bought her lion's mane mushrooms from Paul Stamets, great mycologist, I think they call him. But I gave him, she's taking that right now, and that helps with the synapses and all that stuff in the brain. Then, what did I give her? I've tried a couple. I've tried Illumina. Didn't seem like it worked. But now, what I have to do is she's got a cup in the on the shelf. So I go in and I know she uses that every day, every night to drink out of. So I go in and I just throw some sugar tablets, some little tiny sugar tablets. I throw in her cup, and then when she gets water that night. Now I'm thinking she takes it, and even if she does pour water in and then spill that out, she still has a drop of that medicine in there. Oh, this cat's gonna get out! Dang nabbit! I should have let it out. But she's got a little bit of that water in there, so I think she's still getting the medicine. So it's hard to see if it's actually the right medicine or not. Come on, you idiot. Get out of here, kitty cat. You're ruining my talk. So anyways, I give her a medicine that way. And but I'm telling you now, if I hit it right, sorry about all that. If I hit it right, you can tell this is an AI. That's going to be a whole nother ball game. What's real? You look at some of these videos and that, and you can just tell this person isn't real. They're moving, but in the same way, and their eyes are blinking the same way. People are going to get tired of that, and they're going to want to be with people. And that's why my community, you come in, you can actually hang out with me. But like my sisters, had hip pain, and she probably not taking it still, but I told her to take, what was it, kelp carb. Yeah, kelp carb for her. She had like an osteoporosis, bone deterioration. Was it kelp carb? Anyways, I'd have to look it up again. You can't keep all the medicines right there, but I pretty sure. And she started taking it, and she said, "Oh yeah, my pain's gone." Yeah, well, now if you want your bones to get repaired, you need to continue taking it. So it just saddens me to see people. They've done such a job in depressing the idea that homeopathic medicine is a viable system of medicine, that people just don't even know about it. And that's why I'm doing this, to get it into their minds and hopefully eventually get it into their hands. Because once you hit the right medicine, boy, it's like night and day. Whatever ailment you had, whatever thing you had going on, it just clears it up. And it isn't the medicine goes in, the body rises up to fight what I put in, and the vital force becomes stronger and clears up that symptom, because we're all fighting bacteria, we're fighting I don't know, we're fighting all these diseases. And like I always say, they asked my mentor, they said, do you cure cancer. He said, well, I haven't seen a tumor walk into my office, but if I do, I'll give it a good shot. He says, we treat the people. So we treat the person, not the disease, number one. Also, we're not fighting against any disease. We're finding out where did this disease come from? And there's a whole philosophy behind that. But the idea is there's all this science behind it. The art is figuring out how to, observe what's going on with this person. Because now once you get the proper symptoms, what's going on with them. And it can be as easy as like my wife, I got a headache and I can't do nothing and I got 10 Tylenol PM and say, oh, I don't know what to do. I just get home from work. I'm like, I'm hungry, I'm dirty, I'm tired. I'm like, okay, what's it feel like? Burning, stabbing, throbbing, burning, stinging, what's the headache feel like? And that's all I asked her. And she said burning. And I went and got arsenicum, gave it to her. I don't know how I gave it to her, water or just in a pill form. But anyways, I gave it to her, went and took a shower, came down to eat, and she's on the phone talking like nothing happened. Now that's a cure. Well, at that time that was a cure. She still gets the headaches. Now what I'd have to do is change her diet, change, she smokes, so all these things contribute to our demise. And he calls that social miasms, or these constructs that we have. You have to be vaccinated, you have to have uh, um, you should take these drugs, and drinking is a acceptable way of having fun. Poison yourself with alcohol to have fun. All these different concepts, religious concepts, work concepts, all these concepts that we have that causes us to get sick and keeps us sick. We're all stressed out. We're eating food that isn't food. We're eating stuff that isn't food, basically. And then we're wondering why now our body's breaking down and we're getting sick. So once the homeopathic medicine would come in and remove something, then you would have to, as a health coach, I'd have to work with somebody to overcome the reason why that happened. So anyways, Carboneum sulphuratum, which is bisulfide of carbon. Where does it come from? Carboneum sulphuratum combines many characters of its two elements, carbon and sulfur. It was first brought into notice by its effects on workers in rubber work. So they're making rubber products, and these people got poisoned by this substance that they use to make it. And that's how we find out a lot of times what it's good for. If you get poisoned, I want to know what it did to you, because I know then if someone else has that sickness, that same symptoms in a sickness, whether it's a flu, a cold, a grief, it doesn't matter what it is, someone has them symptoms, then I can, if I match those symptoms to the medicine that other person got poisoned by, it'll take care of those symptoms. Because the symptoms basically are the body's way of fighting whatever poisoned them. Whether it's a herpes or whether it's a gonorrhea or whether it's a grief. That's a poison, a grief. Any kind of grief or loss, or all that affects you in a way. Such a way that it needs to be overcome with. Basically with homeopathic medicine. So they got poisoned in the rubber works. This remedy has a deep and disorganizing action. So it's a very deep acting remedy, number one. And there's a lot of disorganization, which is in the muscles, the veins, the this, the that. So, and an immense range of action. So, that's almost like a polycrest, because the range is all the different things it can take care of. And the symptomology. So a lot of different symptoms, eye symptoms, ear symptoms, uh, urinary symptoms, leg and arm and spine symptoms, a lot of symptoms for this medicine. So in the Medical Argus, which is a paper back then, H. Crippen has collected from several sources instances of intoxication of workers with carbonium sulphuratum. So he collected all these people that got sick. The action on the vision was very marked. So big eye remedy. in many cases, myopia, anstenopia, archimopatosia, dyschromatopsia, all this opsias. Basically, color blindness, uh, vision blindness, a scotoma, which is you can't see in the middle of your eyes. You can see things on the top and the bottom, but the middle is blocked out. So there's all these big terms for basically eye problems. Cloudiness and atrophy of optical disc. So you see, like my dog right now, he's older, and I look in his eyes and it's like kind of opaque, so you can tell he's not seeing very well. Um, and when it says atrophy, the optic nerves, in the disc is not working. Central scotoma, that's what I was talking about. The middle of your vision's gone. For light and color, so they can't see light and color in the middle of their vision. Retinal congestion, arteries and veins are tortuous in the eyes. Veins are distended, arteries contracted. Now, this isn't the eyes. Arteries and veins tortuous, veins are distended. This sounds like varicose vein stuff. Arteries contracted. The optical discs are pale. Everything seemed in a fog, as if spiders web over objects. And they lose green and red. They can't see green and red. That's color blindness. One patient had complete right side hemiplegia. So now when someone has a stroke, right side, my buddy's was left side. When someone has a stroke and they have hemiplegia, is basically loss of movement, or loss of uh, what do you call that? Hemiplegia, paralysis of one side, the right side. So right-sided paralysis. I think causticum is more left side paralysis in a stroke. Following sudden loss of consciousness, and it's very easy to look that up. I look in under stroke. I look under mind. I think it's brain or mind. Then I look under stroke, and then it gives me medicines. And then when I look up the medicine, it tells me a left-sided paralysis, or like this one, a right-sided paralysis. Blindness of right eye and great impairment of vision of left. So the total blindness of the right eye. And it's funny that you have right-sided paralysis too on the body. Loss of memory. So this could be a Alzheimer or dementia remedy, especially for words. They can't get out the right word they want to say. I'm having that too. I might need some of this. Was a very frequent symptom, so they can't get they're talking. They're trying to convey something, and they can't find out the right word to say. Delusions were common, so they have these delusions. They heard voices and believed he had committed a robbery. So these are delusions. He's believing that he's in trouble for committing a robbery or any kind of thing like that. And he's hearing voices. Sensation of a hole close by into which he has a danger of falling in. So he feels like there's a hole close by. So these are the symptoms that are coming from the poisonings, a lot of them, of the that he collected. This guy collected it, and he had all these symptoms. And when we get these symptoms, now we know if we hear that in a person that's having a problem, then we know this will work for that. So these people are, this organization of things. These people are broken down, weak constitutions. So they're very sickly. They can't fight off diseases. Carboneum, sulphuratum, alcohol abuse. So any alcoholics, this could be one to help them through any symptoms from that. Lack of vital heat, wasting muscles, skin, and mucous membranes. So that's the disorganization of the muscles, skin, mucous membranes. And it has an affinity for the eyes. Chronic rheumatism, so people having rheumatism that are chronic, you would consider this. And, sulfur alone and the carbons, some of the carbons have that in it. Diminished sensation of arm, hand, and feet. So there's that paralysis. They can move them and use them. That's a 3. So numbness, basically, in the hand, arm, and feet. Impotence in the male, I would imagine. That's a 3. Lead poisoning. Anybody that's been poisoned by lead. Now, I don't. There's a medicine called plumbum, which is lead. I don't doubt that that would be, some of these symptoms. A lot of these symptoms would be in there. Better open air. Worst after breakfast. So after they eat, it's worse. When they get out in open air, they feel better. Worse from bathing. Worse warm, damp weather. So that's probably the rheumatism that damp weather in the warmth affects them. Ill effects of coal gas. So back then they were burning a lot of coal, and that coal gas would poison a lot of people. Irritable, anxious, and intolerant. That's what these people are like. They're very irritable. They're very anxious and intolerant of others. Sluggish, not able to function very well. Hallucinating sight and hearing. For dementia alternated with excitement. So they can't understand, they can't function, they're sluggish, and then they get excited and they get, you know, um, uppity. Irritable, anxious, intolerant. That's the big ones. Pain with swelling from flatus. So a lot of gas with this, and that's probably the carbon one. Carbo-veg has a lot of gas. Sulfur can have it too. Then distension with soreness and rumbling. So the stomach's distended. It's a lot of rumbling in there. The stomach's sore. Sore means to touch. And there's a lot of gas and swelling going on. No back, no chest. And now there should be back because it says it affects the backbone. Hearing impaired, buzzing and singing in the ear. Tinnitus, which is another ear thing. Arium, that's just that ringing in the ear. Meniere's disease. Now, my sister had that. I think she might have had that. I don't know, but I know now she has a hard time hearing in her one ear. And I tried a medicine or two, but you really have to have somebody that you can. I tried to ask her what's going on, and if I don't get symptoms, it's hard to get you can look under Meniere's disease, but it's, there's a few medicines there. And if someone's not patient, because a lot of even homeopaths, they'll try a medicine, that's not working. Why isn't that one working? Then you try another medicine and you go back and you ask questions, that help you to determine between the medicine. You're looking for differentials, and that differentials is like, where is it? Modalities. Better in open air. When does it feel better? And if they said open air, that would lead you to Carboneum, Sulphuratum. After breakfast, man, I just feel sick. That would be, so you're looking for these kind of things to determine between anywhere from 3 to 10 remedies. You really want to get it down to 3 remedies that you think is what's going on, and then you pretty much go back and you say, okay, what makes it better, what makes it worse? And a lot of times I just use that, like I asked my wife, what's it feel like? That's the sensation's another one you can ask. But what makes it feel better, what makes it feel worse? That always helps. Because you've got 2 medicines. One feels better by cold air, one feels worse by cold air. And you gotta, what makes it feel better? And if they said cold air, you'd go with it. If they said warm air or whatever, warmth of bed, you go with the other one. So that's how you're determining between them. So Meniere's disease, loss of vision with central scotoma, which they can't see in the center of their vision, is gone. Myopia, nearsighted. So that's, anyways. Color blindness, even red and green. That's one of these other ones. Like, oh, here we go. I got it marked down, I think. Asthenopia, which is what I was reading. Eye strain. So anybody have an eye strain, you'd consider this. Color blindness, which is dyschromatopsia. So, and there, yeah. So anyways, those are big terms for colorblind, eye strain, myopia, nearsighted. Optic neuritis, which is nerve pain in the eyes, and advances towards atrophy. So this nerve pain can become where the eyes aren't functioning. Atrophy is just they're not working. Arteries and veins are congested. Oh, that wasn't the eyes. Sorry about that. It wasn't the other vein. And I don't doubt the other veins and how to be affected if the eyes are, but they're congested. So there's a lot of blood up in there. Vision is greatly impaired. Seems like in a fog. So when they're looking at things, it seems like there's it's just foggy vision. And that can be the, this, the opacity of the eyes. They're just losing their vision. Headache, dizziness. Headache with dizziness. Aches like a tight cap. So like something squeezing the head. Ears feel obstructed. So that's yeah, that can be about anything, and that's where this, you relate this head stuff to the ear stuff, giving you, the ears feel obstructed. You're getting Meniere's disease. You got this ringing, buzzing, all that kind of stuff, and noises in head. Now, there's another remedy that was talking about, like the sutures in the head are opening and closing because your head's not solid. Let's see. Ulceration of lips. Now, this is like in a herpes situation. People get cold sores. That's basically herpes. Anesthesia of mouth and tongue. So there's a numbness in the mouth and tongue, just like there's a numbness. Where is it? Diminished sensation in hands and feet and arms and that. That's that numbness. So this numbness is also uh, in the mouth and tongue. And that ulceration, like I said, is the herpes simplex, which they also said is in the hands. Where's the limbs? I'll get to the limbs. Let's see. Fingers are swollen, insensible. Okay, where are we at? Headache, dizzy. I did that. Kidney. Okay, there's no kidney, no heart. We're on the limbs. Herpes on dorsal, which is back surface of hands. So there's that herpes coming out in the hands. Now, if you took regular medicine or common medicine and you were putting stuff on, like the one person puts cream on the herpes on the lips, it goes away. The body is trying to push that out, whether it's the hands, the lips, wherever it's trying to push this herpes disease out. You would basically utilize a medicine like this to clear it up. When you give this medicine, that herpes may pop out worse. It may come out a lot worse. You'll get a lot of blisters coming out initially. And then if you don't put something on it, like an antibiotic cream or something, and you let it go and you just soothe it with like an oatmeal thing or something, even honey or aloe vera or something to soothe it, the body will push that herpes out and you won't have them cold sores, herpes sores on the mouth and lip anymore. Sore, bruised limbs, anesthesia of arms and hands, cramps in limbs, lightning-like pains. So they got cramps, uh, uh, numbness, cramps, lightning-like pains they can have, uh, fingers swollen, insensible. Now this is the rheumatism type of stuff, and they're rigid and stiff. So the fingers, there's a lot. The rheumatism hits the fingers big time on this. But like I was saying, with this herpes, now they're talking about hepatitis B. Yeah, giving that vaccine to a child as soon as they come out. How would a homeopath handle that? Oh, I'm running out of time. Dang it. Herpes, we would treat the hepatitis B in the mother before she got pregnant, and she wouldn't have that situation anymore. Or when the baby comes out, we would treat it and it would take it away homeopathically, which is much safer. Dang it, I get into talking and I go too long. Flying pains returning regularly for a long time in the limbs and that. Pains in lower limbs with cramps and formication, which is that tingling sensation, and nerve pain, which is neuritis. Male, desire is lost, parts atrophied, frequent profuse emissions, and it's not pollutions. Pollutions is sperm. Emissions is just, like maybe a herpes emission or something. Anesthesia of the skin. They can't feel it. Burning, itching, ulcers, small wounds fester. So the wounds that fester, you think of Carboneum sulphuratum. Useful to restrain the furunculosis, which is multiple boils. So it'll get rid of, useful to restrain the growth of cancer. Sorry, skin cancer, you would think of Carboneum sulphuratum. I'm trying to hurry, sorry. Furunculus, which is multiple boils everywhere. Chronic skin diseases with much itching. And the sleep, deep morning sleep, they want to sleep, but they have anxious, vexatious dreams. So throughout the night, they're having these dreams and they're not sleeping well, but in the morning, they fall asleep and they feel real well, except for that, those dreams still. All right, here's an acute case. A girl, age 15, employed in vulcanizing works, which is rubber. works, which exposed to the fumes one whole day before this. She had from the fumes frontal pains and heaviness of the head. After this, the pains became more violent and were accompanied by painful contraction of masseters, which is the jaw muscles, so they were contracting. Then by stiffness of neck, so it went to the neck, and vertebral column, so that stiffness went from the jaws to the neck to the vertebrae. Finally, of the legs and arms go stiff. They contract or get contracting. The contractor was generalized but nowhere complete, so it was everywhere, but it wasn't fully contracting all over where they couldn't move, though the jaws could not be separated, so that's that lockjaw stuff. Ulcerative stomatitis, which is ulcers in the mouth, ensued, and tartar accumulated on the teeth. We think tartar comes from the tea we're drinking and all that, but it's funny, this is the second medicine that talked about the tartar on the teeth forming. And the other one said when they took the medicine, the tartar just fell right off. You don't need expensive bleaching agents for your teeth. Among the chronic effects are digestive disorders of extreme severity. So they're having, that's where all that gas is coming from. Tremor, giddiness, ringing in the ears with poor hearing, inability to sleep, muscular weakness, more or less ataxia. So the muscles aren't working. Strong increase of mechanical muscles, irritability, disturbance of sight and sensibility, incontinence of urine, and impotence. E. case is cured with Carboneum sulphuratum 30C in a slender, nervous woman. The following symptoms: sensation of a weight between the scapula, between the shoulder blades, compelling her to bend forward, so she's stoop shouldered. And that's sulfur patients they are stoop shouldered. You see someone stoop shouldered, you think sulfur right away. Throbbing in the dorsal spine as if the heart were beating there. Constipation with ineffectual urging to stool, so she can't crap. Hemorrhage of bright blood from rectum after stool, with itching of anus after the stool. Also in the night, feet swollen, hot, and throbbing in the evening. Carboneum sulphuratum has the flatulency of carbo-veg and the abdominal soreness of sulfur, abdominal snowman. It produces eruptions of herpes and impetigo. So discharges excoriating and producing violent itching. So there's a lot of herpes simplex disease with this. It corresponds to the herpetic diathesis. Diathesis is inherited herpes. The child was born with the herpes. Or the herpes miasm, they call it. It doesn't have to be the full-blown disease. It can be a miasm that sets them up for different symptoms. The pains are burning, tearing, jerking, and stitching, and are apt to return at regular intervals for a long time. So these pains come and go. Pains, but they last for a long time, and then they go away, and then they come back. Pains come and go quickly. The periodicity shows itself as in diarrhea, which comes every 6 weeks. Every 6 weeks they have diarrhea. They're constipated otherwise. The worse from warmth, common, common to carboveg and sulfur. They both have worse from warmth. Shows itself in toothache brought on by warm food. So warm food, and I would imagine for warm water. There's another medicine that you put the cold water in for the toothache and it feels better, and then the cold water goes away and it starts aching again. Vision better in evening and twilight after eating. Worse from slightest motion from walking. Worse at night. Sleep is restless with tossing in bed. A feeling of vibration and trembling in the whole body, particularly in the hands. Anesthesia of the skin and mucous membrane. So no feeling in the mucous membranes or the skin. All right, I would love to get into the medicines, like anacardium, hears voices. That's another medicine. When they're hearing these voices, you would look it up and it would say Carboneum sulphuratum, anacardium, and probably a couple other ones. Cannabis indica, opening and shutting sensation in the head. So that's that noises in the head. There's where I got that. Yeah, I knew it. I could, anyways, Calibix silica, sulfur, hair sensation in throat. So these are the symptoms, how you determine between them. And I'm way over on a small medicine. Well, anyways, that is morning medicine, Carboneum sulphuratum. Tomorrow is carcinosum, which is a cancer not nosode. So that cancer nosode is a major, major turning point in a lot of things, and we all have the miasm of this is a whole nother subject that I can't get into, but carcinosum is a big remedy, major remedy. You want to be there tomorrow to check it out. All right, that's morning medicine. You can age, but you don't have to get old.